Hello and Assalamu alaikum. This is the CBCT of the patient that you requested. Now, the area of interest here is the upper right region where there is the first molar, the second molar, and the periodontal spaces between them. The patient is complaining of mild discomfort. This is the 3D rendering of the patient. This is the OPG. As you can see, we don't see any major pathologies, but we do see two restorations in the upper right 6 and 7. Moving to the transaxial view of the upper right, this is the mesial root. We're at 150 micrometers, as you can clearly see. The mesiobuccal root has two canals, one very faint MB2 and a very proper MB1. This is the entrance of the MB2. Moving towards the palatal aspect, here you can clearly see that the restoration does show signs of leakage, and that leakage is associated very closely to the pulp horn in the mesiobuccal region. Moving towards the palatal aspect of the palatal canal, we do see a wide palatal canal with no periapical pathologies as such, but we do see a very slight PDL widening and a small pathology right at the apex of the palatal canal. So that needs to be clinically checked as well. We've got a apical delta, which needs to be seen if a endodontic treatment is done. Moving to the distrobuccal root. So this is the distrobuccal root. We've got one single distrobuccal root, no periapical pathologies, no perforations in the cortical plate, and no sinusitis seen as well. If we move to the 7, the upper right 7, we can see a little bit of a shadow underneath the restoration, but does not seem to be the major reason of pain. We've got two fused roots and a proper anatomy there. This patient does not have a distrobuccal root. The patient only has a buccal and a parietal root, and those are fused, and the canals are two as well. No periapical pathology or signs of sinusitis seen here either. Moving to the axial view at 150, so this is the upper right 6, this is the upper right 7. If I can take you to the crown, so this is just at the pulp chamber. We might see a little bit of a pulp stone situation here. Moving down, we can see that these are the three major canals. A very slight orifice seen here for the MB2 right there, and then as we move downwards, we can see that it's clearly the apex exits out as one. In the upper right 7 region, we don't see any micro cracks or fracture lines, but we do see a bean-shaped canal configuration. So this patient has one single pulp chamber, and then at the apex it just distributes into two apices, and then that's basically the situation for this patient. We would not recommend any fractures or anything, but however, I do feel like the 6, the upper right first molar might show a little bit of a dentine hardness underneath the restoration. As you can see, a dentine shadowing right there. So this is very close to the pulp horn. It's more visible on the transaxial view, which is exactly here. So we see a little bit of a leaking of the restoration and a little bit of dentine discoloration. I won't call it radiolucency, but we can clearly see that the dentine shows a little bit of a reduced thickness on the CT scan, and this could be associated with the mild discomfort that the patient is feeling. So a change in restoration or a verification of the leakage, that's the first way to go. A patient, if it does not have signs of irreversible pulpitis, we would recommend that a change in a restoration should relieve the patient of any pulpal symptoms or discomfort, and the pain should go away. Thank you very much.